Hello, everybody. Welcome to Ms. McGuire online video lecture. And today we continue covering the urinary system. In the first lecture, I covered anatomy of kidneys and nephron, and I will put link to that video in the description box, right? And today we will cover rest of the urinary system organs. Okay, so let's go ahead and begin. So kidneys are the major organs of the urinary system. They filter your blood and produce urine. And so here we have right and left kidney. But in this lecture, we will talk about accessory organs. Well, I wouldn't really call them accessory, but just organs that are not directly involved in the production of urine, but used for transportation and temporary storage of urine. So ureters. So we have right ureter and left ureter. They convey urine from kidneys to the urinary bladder. Retroperitoneal. That means, okay, you have your abdominal cavity. In abdominal cavity, you have like a sac, like a bag. We call it peritoneal cavity. So many organs, like your stomach, your small intestine, part of the large intestine, they located inside this peritoneal cavity, but kidneys and ureters, they are behind that cavity. So ureters enter the base of the bladder through the posterior wall. As bladder pressure increases, distal ends of the ureters close, preventing backflow of urine. So when you have urine fill your bladder, you don't want urine start backing up, right? That's why when pressure increases, then there will be opening of the ureters, and that will cause the muscles to contract. Ureter has a smooth muscle in their walls, and when muscles contract, that will prevent, they will close up the distal end of ureter, so urine cannot flow back towards kidneys. Urinary bladder is a muscular sac for temporary storage of urine. Also retroperitoneal on pelvic floor, posterior to pubic symphysis. So pubic symphysis is the cartilage. It's a joint between two hip bones, and it's anterior of your body, right? Of course, it's behind your skin and muscles, but if you compare your pubic symphysis and urinary bladder is posterior. Males, they have prostate glands that surround the neck of urinary bladder inferiorly, and females, urinary bladder is anterior to the vagina and uterus. So that means in female, you'll have urinary bladder. Behind, you will have uterus, and behind uterus, you will have a rectum. In males, you have urinary bladder. Below will be prostate gland, and behind is rectum. So urinary bladder has a structure, very important, called trigone. It's a smooth triangular area that outlined by the opening for the ureters and urethra. So here's the opening of right ureter, here's the opening of a left ureter, and this is the opening of urethra. And this structure make this triangular, or these three openings make this triangular structure called trigone. Now, in this trigone, we have stretch receptors that send signal to your brain that your that your urinary bladder is full, right? So you have stretch receptors, send signal to brain, urinary bladder is full, right? Now, it's also the area where infections tend to persist. So that's why when people have infection of the urinary bladder, those stretch receptors fire and send signal to the brain, and people with urinary bladder infection feel urge to urinate frequently, even when their bladder is not full with urine. Now, this is male urinary bladder. So here's urethra, and inferior to urinary bladder, this structure shown here in kind of like bluish color, that's prostate gland. Layers of the bladder. So we're gonna look from deep to superficial. So inside we have epithelial tissue. It's a transitional epithelial mucosa. Then we have thick layer of muscles called detrusor muscle that made of 3 layers of smooth muscle. So over here, that's a muscular part. And superficial is adventitia, that is connective tissue. On the superior part, we have peritoneum. And the lateral and inferior part, we have adventitia. And remember, peritoneum is actually serosa. So that's a serous membrane. Urethra is a muscular tube. Lining epithelium is partially, it's a transitional epithelium. And then we have pseudostratified columnar epithelium. So transitional epithelium close to the bladder. Then we have pseudostratified columnar and stratified squamous near to the external urethral orifice. All right, so inside the urinary bladder, remember, we have this transitional epithelium. So this transitional epithelium continues to the superior part of the urethra. Then it changed to pseudostratified and stratified squamous. Sphincters of urethra. We have internal urethral sphincter that is involuntary smooth muscles at bladder urethra junction. So here's your urinary bladder. That's a big muscle called detrusor muscle. That's a smooth muscle. And this inferior part over here, we have internal sphincter. So that's a circular muscle that is under involuntary control. It contracts to open. And external urethral sphincter is voluntary or skeletal muscle surrounding the urethra as it passes through the pelvic floor. So here you have a pelvic floor, those skeletal muscles, and external urethral sphincter is inside this pelvic floor. Specifically, this part of the pelvic floor is called pelvic diaphragm. And those are voluntary muscles. So you have 2 sphincters to prevent you from peeing into your pants. Internal sphincter that you cannot control. It's controlled by autonomic nervous system because it's made of smooth muscles. And external sphincter that you learn how to control when you age 3, right? So you know how little kids cannot control their urination, and then when they get older, 2, 3, 4, then they know how to control the sphincter, and they only open it when they're ready to urinate. Now, female and male urethra are not the same. Female urethra is a short structure, 3 to 4 centimeters or 1.5 inches. It's tightly bound to the anterior vaginal wall. External urethral orifice is anterior to the vaginal opening and posterior to the clitoris. That means external urethral orifice, it's an opening, right? Opening of the urethra. So it's before the vaginal opening. So urethral opening anteriorly, behind will be a vaginal opening. So you can see trigone again over here, internal urethral sphincter, external urethral sphincter through this part of this urogenital diaphragm or pelvic diaphragm or pelvic floor, that different names for the same structure. Right now, if you look at male urethra, then it's a longer. It carries semen and urine and has 3 main regions. Prostatic urethra, about 1 inch, and it's within prostate gland. So here's the urinary bladder, right? Here's our trigone. And remember, inferior to urinary bladder, we have prostate gland. So the urethra actually passes inside the prostate gland. So prostate gland surrounds the urethra. And this part of the urethra is called prostatic urethra. That makes sense, right? Then this is our diaphragm, urogenital diaphragm of pelvic floor. Now, when urethra passes through this diaphragm, it's called membranous urethra. It's 0.8 inches. So that's a shorter part of the urethra, and it passes through the urogenital diaphragm and spongy urethra. The spongy urethra is inside penis. And it's the longest part, about 6 inches, passes through the penis and opens via the external urethral orifice. So that's the opening. Right now, this structure over here, shown like in the pink color, that's erectile tissue of penis. Micturition. Another name is urination or voiding, and it's made of 3 simultaneous events. First is contraction of detrusor muscle by autonomic nervous system, opening of internal urethral sphincter, also controlled by autonomic nervous system, and opening of external urethral sphincter by somatic nervous system. And somatic nervous system means that's under your voluntary control. So here's a urinary bladder at rest. So here you have bladder, you have internal sphincter, you have external sphincter, right? And that's your central nervous system that innervates your external sphincter and keeps it contracted, right? So if it's contracted, obviously you don't pass urine. Now, during urination, when urinary bladder is filled with urine, it activates the stretch receptors in the wall of urinary bladder, especially in the trigone, remember. Now, those stretch receptors gonna send signal to your nervous system, and nervous system respond to the detrusor muscle, and the detrusor muscle contracts. It's also sends signal to internal sphincter. Internal sphincter contracts, and when sphincter, when it contracts, internal sphincter, it actually opens up, right? So the urine start leaving right through the urethra, entering urethra, and at the same time, look, it's blocks this somatic neuron that innervate your external sphincter, and external sphincter relaxes, right? So you can go and urinate. Now, some homeostatic disbalances of urinary system. So the first, renal calculi, or kidney stones that form in renal pelvis. So here's our kidney, and that's a renal pelvis. And here's the formation of kidney stones. Kidney stones are crystallized calcium, magnesium, or uric acid salts. Now, larger stones block ureter, you see over here, causes pressure and pain in kidneys. Maybe due to chronic bacterial infection, urine retention, increase of calcium in urine and in blood, and increase of pH of urine. So treatment is shock wave lithotripsy. That is non-invasive when we use the shock waves to break down these larger stones into smaller. So it's a shatter calculi, and then you will pass the smaller pieces, and hopefully, you know, you get rid of all of these kidney stones. Incontinence. Incontinence is when you pass urine involuntarily. So usually from weakened pelvic muscles. there is two types of incontinence: stress incontinence and overflow incontinence. Now, stress incontinence, when increased intra-abdominal pressure forces urine through external sphincter. Overflow incontinence, when urine dribbles when bladder overfills. So here's our overflow incontinence. When sudden release, you have a sudden release of bladder or difficulty emptying the bladder. Stress incontinence, loss of bladder occur during jumping, running, laughing, sneezing, right? That's when we increase intra-abdominal pressure. And, and this external sphincters, just muscle get weak for many different reasons, and it cannot keep the sphincter closed, right? It's a weak muscles, allows this dripping of urine. The stress urinary incontinence sometimes happen in pregnant females. So pregnancy is the main risk factor for the development of stress urinary incontinence, or it's called SUI. Common causes of pregnancy incontinence include pressure, hormones, medical condition, or urinary tract infection. But before we get to all of these causes, let's review anatomy of the urinary system and how it is related to reproductive system. So that's anterior part, that's a posterior part. So here on posterior, we have a rectum and anus. And anterior to the rectum, we have vagina. So that's a vagina connected to uterus. And anterior and inferior to the uterus, you have urinary bladder. And then here's your urethra. So you can see, this relationship between uterus and bladder. So uterus pretty much above the bladder. Now that's what happens when female is pregnant. So when baby is growing inside the uterus, right, it put extra stress on a urinary bladder, and that can cause stress urinary incontinence. So what are our major or common causes? What is this pressure? Fetus puts extra pressure on the bladder as they grow bigger. Hormones. Changing hormones can affect the lining of the bladder and urethra. Medical condition, diabetes, multiple sclerosis, anxiety medication, and of course, urinary tract infection or UTIs. Incontinence is actually a symptom of UTI, right? So, so if you know and understand female anatomy, then you can explain why pregnancy is a risk for development of incontinence. Okay, so this is our last slide for today. Thank you very much for watching, and I hope it was helpful. Now, if you have any questions, leave your questions in the comments below this video, and I will be happy to answer them, or maybe even record extra video that will help you to understand material better. Right, so have a nice day, and see you next time.